Angie's with the library.
Then they should, whoever signed,
Anthony Peter is with the library.
whoever signed the application.
Okay, you're live now. Let me just get the names.
So they can hear us now?
Everybody should be able to hear.
Good evening, everybody. We're going to start our social services hearing. Sorry about the delay. We had some technical difficulties here. I think Mike's going to go through and we want to make sure we got everybody's name who's tuning in tonight, so we make sure we don't leave anybody behind.
Do you know who Angie is then?
Yep, I know them.
Okay.
Let's just go to the numbers we don't know.
Okay. We're looking for DC 964.
City of Amboy, Lake Stanfield.
Hey, Frank.
So what would you like that called?
You can put Frank on there if you want.
Frank?
Stenzel, Stenzel.
Okay. And then, we got, is it? That. You good with names so far?
Yep, let's go down to that 6815625.
Okay, we need 815-625-7809. We could have a name for that.
This is Linda from KSP Hospital, Meals on Wheels.
Thank you.
All right, let me get that. It was Linda, Meals on Wheels, right? Okay.
You see it.
And then we have 815-677-9043. Eight 677-9043. We get a name on that? Need to unmute.
Susan Lawler, wasn't it?
Yeah, she's right there.
Oh, she is, okay, let's see.
Trying to unmute it, but 815-677-9043.
Yeah. It's a program that goes in
Anybody?
Well,
We got everybody? Or we,
Is that the Flushing Catholic Charities? I don't see that name up here.
I've seen them somewhere. It might be,
Okay,
This is Kathy Waitman Moore. Catholic Charities is the ombudsman program.
okay. We're just trying to figure out who everybody is.
Got it.
Yeah, I can't unmute. I've tried this one, so.
okay, let's just start and we'll go from there. All right, I think we got everybody on. This is gonna, thank you for tuning in and we'll see if we can get through this. We're just gonna start out at the top of our list. I don't know your names to who I'm gonna call on, but I'm gonna do it with the Lee County Council on Aging.
That's Susan Lawler.
Okay, Susan.
That's Susan's office.
Okay, that's the one we're looking for, Susan. All right,
Okay.
you wanna tell us a little about what your program and what you're asking for?
Okay. Lee County Council on Aging is a senior program for 16 years and over. We are asking for $71,000 this year. We are the only agency in the area that has remained open during COVID. We are doing appointments face to face. We have done over 7,000 rides during COVID, and we have done over 14,752 people this year that we've seen. We did 2,000 lunches, and we have done 1,025 United Way lunches to help them out during this program and this hard time of COVID. We have a library outside. We make 900 phone calls every 2 weeks to all the seniors in the community. Upcoming October 15th through December 7th will be open enrollment for Part D, which is the prescription drug program. We will see in person or on the phone over 800 people during that 7-week period. We have been active in putting census out there, and we have been told that we are number one in the communication of census to the Lee County community. We also give away free phones to the hard of hearing. We do test them. We are the only one in the area besides Whiteside, and they have been closed through COVID. We have 17 vital programs for the seniors in this county, and we are also been acknowledged by Northwestern Illinois Agency on Aging, which is a state agency, as a model agency by the state. We are very proud of our seniors. We are very proud of our staff. They have worked extremely hard. Our drivers have been out there face to face with and bringing our seniors to KSB Hospital, to dialysis, to chemo, to all their medical appointments, to the groceries. We have been very proactive through this whole process, and we continue to do so. We have shields on our desk. We have gloves, temperature readings when anybody comes in the door. They can receive masks. We have sanitizers on every corner of the building, plus all around the bathrooms. We have been very, very proactive during all of this. Our buses have shields on them to protect them. The drivers wear masks. We hand masks and gloves to passengers as they come on. We're looking forward to continuing this process in the years to come, and hopefully that we will service Lee County as we have in the last 45 years. Thank you for having us.
Thank you, Susan. I see your budget, you're running around 500,000. You think?
It's what we have, but this year we're going to take a deficit because our expenses are going to be exceeding what our income will be. We are anticipating a projected revenue of 506,425, and we're projecting a deficit of 32,285 this year.
I see that. Is there any CARES grants or anything that's able to help you guys?
I do.
Okay.
I've applied for the PPP loan. We've been accepted for the PPP loan, and I received 68,000. And I am optimistic that they're going to forgive all 68,000. I have put in for the CARES Act, and I did receive 26,000 for the CARES Act, and I also did FEMA. So for the lunches, to pay for the lunches. So I did get funding from FEMA. I only got 3,000, but I did get funding from FEMA. NIA, which is the one of our major programs that give us funding throughout the year, is a Northwestern Illinois Area Agency on Aging. And they have held off in giving money until everybody gets their CARES money, and then they are anticipating coming back to give us funding again. So that's a little scary. United Way, as many of you know, we're not allowed to do applications this year because they didn't know where they're going. So what I typically get from United Way, I will not be getting at this point this year. The difference of not getting certain funding is going to make the difference, whether I can make a break even or take a deficit. We are utilizing best employees, and when we lost an employee this year who died, and we did not replace that employee. We have been struggling to service our community, and we haven't cut any of our services. Yet our staff is, struggling because we're putting a lot of hours. We're working weekends and nights so that we don't increase our payroll. So we've worked very hard here. I think we'll make it without the deficit, but I don't want to go in saying we'll break even this year when I can't predict what's going to happen.
Sure. Any questions from the committee?
When you mentioned rides, those are through lots?
I'm sorry, I couldn't hear that.
When you mentioned rides, you're talking about rides through the LOTS program?
No, we have senior ridership, and we are partnered, and we work hand in hand with LOTS. There's no doubt about it. But the senior ridership alone is 7,000. And we are the one, we have 5 vehicles, and we have our 5 vehicles that have done 7,000. We also, on top of the 7,000, service any of the overflow from LOTS. And because Hub was closed during all of this pandemic, we picked up Hub's ridership. And because Rock River was closed, we picked up Rock River's ridership. We also picked up Whiteside, but that doesn't count. But I don't get credit for that. But I do get credit for what happened with Hub and Rock River. So our 7,000 is a strong number. I would say it's going into now this fiscal year, we've already done in the month of July 2,100. And August has already, we finishing up today, we'll probably have about 2,400 for this month. So we have been pushing very strongly, and we're helping lots, I would say, daily, and you know, checking on them. They'll throw riders on us when they can't service them. So we've been working very strongly together. In fact, we have, I put a grant in to get the sensors wraps on the buses, and I also put the wraps on Leogo's transportation buses through my grant.
Thank you.
You're welcome.
All right, well, thank you, Susan. Thank you.
You're welcome.
All right, let's go to Lightscapes. Mike Hughes.
Yes, how are you?
Good, Mike. Thanks for joining us tonight.
Well, thanks for having us, and thanks for doing this remotely. This has been a crazy year and a crazy world, so thank you for still having this. I see a tremendous amount of value in getting together at least once a year, and I see a lot of friends here that we work quite closely together quite often. So thank you for hosting us. Lightscape Community Services, we're asking for 2 different programs that we've received funding from the county for before. Number one is our Home Delivered Meals, our Meals on Wheels program that we're designated to do for 4 counties in Northern Illinois. One of them is Lee County. And the other one is our Adult Protective Services program. And let me start with Adult Protective Services. This used to be, if you remember, a few years ago, this was the Lutheran Social Services of Illinois was doing this program. We took it over from them, and they decided to get out of the senior business, dealing with senior citizens. So we've been doing it for a little bit over 4 years now. And I always tell people I really am proud of what we do and everything that we do. But our Adult Protective Services is my least favorite. And the reason is that when something reaches my desk as the executive director of Lightscape, something went wrong with Adult Protective Services. We do investigations and advocacy for seniors and adult disabled people who are victims of abuse. So typically we can handle that at the casework level or at the supervisor level. But at the, when we get an investigation that reaches my desk, that generally means there's some legal action, something drastic happened. So we've been doing that for about 4.5 years in Lee County, and we're asking for $10,000 to subsidize that program. That program every year loses money for us. We don't make any money on that. We actually subsidize it through fundraising and other revenue sources. And that has to do with the way the state funds that. We get money per investigation. So we actually have to go looking for abuse in order to get paid. And sometimes other agencies across the state, open up cases that maybe they shouldn't in order to get paid. We don't kind of do it that way. So that's one that's a net loss for us. So any way we can raise revenue for adult protective services, it's something that really helps. And the other program that we are asking for is our Home Delivered Meals or Meals on Wheels program. That has seen a tremendous increase in need. We're seeing across our 4 counties about a 30 to 40% increase, and that holds true in Lee County. The state of Illinois, up until this year, They have requirements of what it means in order to receive these, and these are free or per donation. So if you can't pay us, you don't have to pay us, but if you can give us a donation to help subsidize the Meals on Wheels. But the state lifted all restrictions, so anybody over the age of 60 can receive Meals on Wheels during this COVID pandemic. Going into this pandemic, we were the only agency in the state of Illinois that was Title III certified that did not have a wait list for our Meals on Wheels program. We were the only one in the entire state that was not having people on a wait list. We ended that wait list in 2016, and we've kept with no wait list, even though it's growing need. So when we have been serving everybody based on the one grant that we get, and then COVID happened, the state lifted restrictions, we've just seen a tremendous increase. On average, our drivers in the past would see about 40 to 50 clients. Our drivers right now are seeing 60 to 70 clients in the course of a day. It has been a tremendous need for that. So our Meals on Wheels program has been going on for quite some time. I tell the same stories when I'm here, and I hesitate to keep telling the same stories, but I will tell you that the meal that we deliver is the reason we deliver it, but it's kind of an excuse because a lot of our clients, our driver is the only person that they're going to see in the course of that day. We have many times found somebody ill, sick, fallen, provide interventions. We've even run into some clients who have passed away. So just to give you a little bit of background about what happens there, if our driver is specifically trained, if nobody comes to the door, they go to our dispatch tries to reach out to next of kin or caregivers. If we can't reach a caregiver or the caregiver is not in town and is concerned, we then dispatch the local police to do a wellness check. And that happens more than you would think in all of the counties that we deal with. So we've just seen a tremendous need for that. We're not sure when the pandemic's going to be over. We're going to keep serving everybody that needs our services. We're never going to have a wait list. As long as I'm executive director, we're going to figure all that out. The reason that this, and again, we're asking for $10,000 for that, we're asking for a total of $20,000 this year. The reason that this is such a big deal for us this year is we have to match every dollar we get from the federal government for this, because we are in a federal Title III Older Americans Act grant through NIA that was mentioned, Northwestern Illinois Area Aging before. But we have to match 15% with local money. If we don't match the local money, we don't receive the grant. So, we do fundraising, we do all these types of things, and money from the taxpayers of Lee County supporting this helps us bring in more money to the community. So we have to match everything about that. We were funded through the CARES Act. The CARES Act did give some Meals on Wheels money. However, and we accepted that money because of the need for it. However, after we accepted it and started putting it into the rotation, the government told us that we had to match that money as well. So we're scrambling to match 15% of the money we received from the CARES Act. For this fiscal year, that ends at the end of this fiscal year. For us, ends at the end of September. So, I guess don't lift a gift horse in the mouth or whatever the analogy you want to use on that. So, we're trying to put everything together. We're going to keep operations moving forward for both adult and protective services or elder abuse and our home delivered meals program. Because we know that our clients and everybody's clients that are here and all these agencies do such a nice job, they're the vulnerable. And let me just say this one word about what's going on right now. And everybody doing tremendous work. We work with every agency here and we think it's a great partnership. Our clients were already socially isolated. Our clients were already separated from the world. Social distancing was not a problem for our clients. We do what we can to bring them out, but this pandemic has made it worse. This pandemic has made health outcomes and psychological outcomes worse. And I say this to every county that does issue senior services taxes. Not every county does this, and it's really an amazing thing to do for the county to support these services. So, give a thought to your elderly loved ones, your neighbors. They're probably pretty isolated in today's world. And Kathy will probably tell you that in the nursing homes, it's probably even worse right now. So, that's something that we take very seriously. And, of course, all the protocols and all those things that we follow. But in order to see them every day, at least that's one interaction that they're going to have in the course of the day. Again, Adult Protective Services, we're seeing an uptick in those cases in this time because people maybe are isolated with a quote unquote caregiver. So the need is so great right now, not only demographically, but because of, the situation the world's in right now. So that was I'm not really good in these Zoom calls. I'm much better in person. So if I didn't say anything right, please correct me and talk to me and ask me questions. So.
No, sounds good. Any questions?
Yep.
Mike, thank you for everybody. We appreciate what you guys are doing. We appreciate the great work you all do. Susan mentioned that they're not getting any aid from United Way this year. Is that true for you guys in Winnebago County also?
Yeah, we were asked not to apply again right now. So yes.
And last year we weren't able to give you as much as you had asked for.
Right.
I know that's not great, but how bad did that impact you?
So I'm going to tell you the way I try to run Lifescape. We're going to figure things out. Don't do this, but because my board would shoot me if I told you what I'm going to tell you now. If you decide to say, hey, we can't give Lifescape money, I'm going to figure it out. I'm going to take care of the clients. Our staff is fantastic. We're going to figure it out, right? It's easier because of Lee County and the taxpayers are so generous with that. So
we don't plan to not give you anything, but
right.
I just wondered how that impact was because this pandemic is hard on everybody, including the tax bodies, so. Yeah,
absolutely. And we, of course, we understand that we're very thankful for whatever we can do and get for our clients. But, again, with the staff that we have and how dedicated they are, we're going to figure it out. So,
okay.
I'm not going to plead poverty and everything, I'm going to say we're going to figure it out.
We appreciate that. Okay, thank you.
Thank you for your honesty.
Yeah, thank you.
Anybody else? Mike? All right, thanks, Mike.
Thank you so much.
Let's go to Emily at Rock River Hospice.
Hello. Thank you again for having us via Zoom. This is really quite nice to be able to do it this way. Again, I'm with Rock River Hospice and Home, and as Mike said, again, I echo kind of a similar thing as other years in that I'm really proud of the work that we all do in Lee County and the surrounding counties. We work together really well with the other agencies. Something unique about Rock River Hospice, we're one of the few not-for-profit organizations in the hospice world. There's a lot of for-profit hospices, as Lynn, I'm sure, can attest to. So it's a little different beast when you're a not-for-profit. And the unique thing about Rock River Hospice is for 30-some years that we have been in the community, we have not passed any cost on to individuals living in the community, which means if you're a patient residing in your home setting, we have not passed a bill on whether the individual has had insurance coverage or not had insurance coverage. We will not deny bringing them on services based on what their need to pay or their ability to pay rather is. So that's something we're very proud of. Our board has supported that. And again, as Mike says, we figure that out. Sometimes there are indigent situations at a higher level than others. And we have served some indigent folks in Lee County in the last year for a variety of reasons. And so we're proud to do that and we'll continue doing that. We too have seen a great need with the uptick of social emotional needs. This pandemic has certainly taken a toll on individuals not being able to see their loved ones. Again, we're happy that we have an inpatient unit that we can allow visitors. And so we have seen some individuals transfer from a nursing facility setting or hospital setting to the inpatient unit for that very reason, because they truly just need to see their loved one before they pass. And so that's an issue that we're seeing. We're seeing that the bereavement needs are much higher when you struggle to see your loved one at the end of life, and you may or may not have that opportunity. The grief process is much different. So those are issues. We too received the CARES Act along with the PPP grant opportunity. So that has helped us tremendously. And we're very fortunate for continued support in the community. Fundraiser efforts are still continuing to happen. Some of those numbers coming in will be, I would anticipate to be a little less just because of the time in which we're living in, and people are being cautious, and that's okay. Again, we too are on hold for Lee County United Way. We are fortunate that in Whiteside County, we're able to get some funding yet through the United Way. Otherwise, our services are full spectrum. So birth to death, we can serve any age bracket. We do have the ability, like I say, to serve in the community, whatever home looks like is where we can serve. We can also serve in our 6-bed inpatient unit, which is located in Whiteside County, but still serving Lee County folks and the surrounding area. We do provide bereavement services for minimum of 13 months after a patient passes to make sure that those anniversaries are being tapped into and making sure that they have all the support that they need. We have a monthly support group that also helps with that process. We have, of course, our nursing staff, our CNAs that go in, chaplain services. We do some contracting with music therapy, variety of services. So we contract with local hospitals to provide some ancillary services when needed. So there's a variety of things in which we are providing. And 84% of our individuals are over the age of 60. So we are seeing some younger folks, unfortunately, come onto services, but the vast majority is still our senior population.
All right. Any questions for Emily? I see you got a $700,000 deficit budget this year. That's going to be, tight, tough to keep things services going.
Right, and we do, and that's again without public support. So when we add in our public support, that looks a little different.
Okay. All right. Any questions, though? We'll keep moving on. Thank you, Emily. We'll go to Catholic Charities. Kathy?
Sorry, trying to unmute here.
You're right.
Good evening, and thank you again for holding this as a Zoom meeting. Again, my name's Kathy Waitman-Moore, and I'm the Regional Long-Term Care Ombudsman for Catholic Charities. We are the state-designated ombudsman program. We serve as advocates for individuals who live in the 14 licensed long-term care facilities in Lee County, as well as surrounding 8 counties. So we cover a 9-county area. And I want to echo what Mike, Emily, Susan have said. I think we have a great partnership in Lee County with all of the agencies. We work together really well. We refer clients and back and forth who need services from the other agencies. So it has been and continues to be a wonderful partnership. We all know what each other does and feel very comfortable in referring to other agencies. So our role is to be the advocate for the resident. We visit facilities on a regular basis, talk to residents, walk the hallways, work to ensure that residents understand their rights, their right to a care plan, their right to a discharge planning. When it's time to go home, we work with them to make sure that they're getting the services that they need and just advocate overall for their rights and the highest level of care so that they can maintain the most ability possible while they're living in a long-term care facility. And then, as I said, move out when it's time to leave. And so we'll refer to the other agencies who will assist with discharge planning, transitioning. We also provide a lot of information and education to individuals about alternatives to long-term care. So that's really important. People call us saying, I don't know what to do about long-term care, so we can refer to LifeScape. so that they can have an assessment for in-home care and then understand the process of long-term care should someone need that. So as everyone else has said, the pandemic has changed the way we do things, and ombudsmen beginning in mid-March had not been able to go into long-term care facilities. As we know, residents of long-term care are some of the most vulnerable to this disease, to this virus, and the death toll on long-term care facility residents has been really high. Fortunately, in Lee County, there have not been any cases other than at Jack Mabley in terms of the facilities that we go into that we're aware of or that are listed on the IDPH website. So Lee County has been very fortunate, and the facilities have done a phenomenal job of ensuring that residents are safe and are not, that the coronavirus hasn't hit the facility. Having said that, Mike alluded to the social isolation. And I have one of our staff ombudsmen who visits Lee County facilities here with me. We're socially distancing at the moment. But I think the toll that this isolation has taken on the residents has been really, really difficult. So many, they're isolated in their rooms, not everywhere, but initially residents were completely isolated in their rooms. Many of you may know this already. You may have loved ones in facilities. You may know people who work in facilities or be affiliated with facilities, but it has been really difficult. And so as ombudsmen, we've really been working to encourage facilities, check on them. Early on, do they have proper PPE? How are residents communicating with their loved ones, and just ensuring that they understand that they still have rights and learning about what their life is like. Since probably the end of March, the ombudsman have been able to begin doing window and outdoor visits with residents, and then of course in June, facilities opened up to other outdoor visits for family members and residents, and now we're in a later phase. The guidance from Public Health was just issued the 14th, effective the 14th of August, which guides the facilities in terms of what phases they're in for reopening. And so that has been really, really helpful. But we've worked very, very hard to stay in touch with the facilities, the residents, and we developed a postcard to deliver to every facility, every resident at every facility, flyers on the front door so people would understand that even though we're not physically in the buildings, walking the hallways as we had been, that we're available to them. I'm going to have Julie talk for a minute. I'm going to move out of the screen and have Julie talk for just a minute about some of the things that she's hearing from residents and some of the issues.
Hello, everyone. Nice to see you again. I just wanted to touch on the fact that what Kathy said about us constantly working to maintain that connection with not only residents, but their families during the pandemic. So we are definitely supporting their independence still and reminding them that just because they are in long-term care and a pandemic is going on doesn't mean that they can't have the independence to move out into the community if that is appropriate and that's what their wishes are. So one thing that I've noticed is that our previous presence in the building really created a wonderful bridge into the pandemic for us to keep that connection, not only with the residents, but also with the families. So when this happened, the pandemic, everything started closing up, there was a lot of questions from a lot of people, and we started getting phone calls. We really started becoming more involved than ever as the questions came, and that need was out there to find out what's going on, and can we still have care plan meetings, which yes, you can. So I believe that has shown me how important the foundation's been that we've laid in the community over the past years. And seeing residents in person now, whether it's an outdoor visit or indoor visits, which I have started, and seeing the residents' reactions to the fact that they can speak with us and speak to someone else from the outside and still reinforce that they have rights and that someone is there to help support them. And their role has really been eye-opening to me. So we want to continue to support the residents and empower them through care planning, but also letting them know that we're there and maintaining a presence with them and their families in the buildings and out as well. Thank you.
So I'll be happy to answer any questions that you might have. And again, we appreciate your consideration. We also have been a recipient of the Lee County United Way. So with the changes there, it does make a difference. Our funding is federal and state funding. We are required to match that, the 15% match that Mike talked about. So the funding that we receive from Lee County does make a difference in that match. We are receiving CARES Act funding. Our funding in the Ombudsman program is different than the funding that the others are receiving because it's under Title VII federal funding. And we are using it for the PPE for the Ombudsman because we're required to have masks and shields and all of the things that we need in order to be able to do our visits, whether it's indoors or outdoors, as well as some technology upgrades so that we can work with residents and families and staff virtually. So that's, I'm happy to answer any questions.
Anybody got any questions? Looks like there's none. Thank you, Kathy.
Okay, thank you so much.
Let's go to Meals on Wheels. Do we have Linda doing that?
We do have Linda doing it. I have to echo what everybody else is saying about the importance of Meals on Wheels. And the nice thing about going after everybody else, there's no sense saying the same thing. We feed about 60 to 70 participants a day. It's a completely, other than the food coming from KSB, it's a completely volunteer organization. We got, I think, $2,000 from the CARES Act, and we're again asking for the $4,000, and if it could be increased, we would be glad to take another 500 or 1,000 if that's possible. And we helped with the Lee County Council on Aging delivering the free meals during this COVID season. And through that, we have picked up between 5 and 10 participants who are on that after the funds ran out. So I think we're looking forward to a few more joining the program. So thank you for your time.
Thank you.
Thank you. Any questions? All righty. I guess we go to the city of Amboy. Frank, are you there, or Brett?
Hi, it's Brett Dewey.
Hey, Brett.
Thanks, Bobby. So the city of Amboy is asking again for the same request that they have done in the past to support the community building, so our ability to host the senior lunch program and the things that we do in the building for the seniors. Everybody's had a different year, obviously. One of our major incomes for the building has always been rentals of events, and obviously that's pretty much dried up for us this year. So speaking to the other programs that go on, I'm probably not the best person to present this. I kind of got caught at the last minute, but if there's any questions, I can try to answer them.
Sure. Any questions for Brett and City of Amboy?
I think we know what they do. We know what they do, so.
Thanks, Brett.
Thank you. Thank you for your consideration.
Dixon Public Library.
Good evening. Thank you for hosting this online. I appreciate the opportunity to still attend. I applied once more for funding to help support purchases of large print materials. We have several subscriptions to various genres of large print. westerns and mysteries and inspirational fiction and a couple of others that are escaping me right now. And each one of them runs us between $400 and $600 a year. So I applied for funding to cover one of those to kind of help us out. The reasoning for the request is pretty much the same as in previous years. And although we were closed for public access for some time, we are back open and have been for more than a month, and we're seeing people coming in and the large print collection is being used. So I appreciate you considering our application.
Thank you. Any questions? All right, thank you.
Thank you.
Serenity Hospice and Home, Angie?
It will be me. Angie submitted our grant proposal, but this is Lynn Canole. I'm the executive director from Serenity Hospice and Home.
Right, thank you. I apologize.
Oh, that's okay. That's okay. Emily always covers a lot of what hospice does. We are also a not-for-profit hospice serving 8 counties, and Lee County is our second largest service area. We also don't pass any costs on to our patients and provide the full gamut of services. It's been a really challenging time, as I had mentioned in our proposal that we submitted. Having to provide care in new ways, being able to get into patients who are in long-term care facilities has been very difficult. So we've had to dip our toes into telehealth for the first time so that we can certify and recertify our patients at times. We've had to move our bereavement groups to Zoom. We also do bereavement in person if someone is interested in us coming into their home. And we did reopen some of our bereavement groups, 10 feet apart, social distancing, that type of thing, because there is a lot of complicated grief going on right now. Many of our patients, if they're in long-term care or if they start in the hospitals, they are not able to have visitors. And so people are dying alone and they're not able to have funerals. And so we're just seeing that there's so much need. We're also just seeing a lot of COVID anxiety in general. We've offered some COVID anxiety free workshop classes online to people in our communities, whether we've served them on hospice or not. We've looked for new ways to serve our families. Our CNAs will do home delivery of grocery items to our families who are unable or frightened to go out and get their own groceries due to the pandemic. So we looked for ways to keep our CNAs busy when they can't get into nursing homes, but also find ways that serve our patients as well as we can. We do have our 8-patient Serenity Home inpatient unit, and we do allow visitors in the inpatient unit, and it's so nice to see when they get there how appreciative they are that they're able to spend time with their family member where they weren't able to do that in the hospital or do that in many long-term care facilities. So that's been a blessing. Our census has grown tremendously since last October by about 30. So we're serving about 90 patients in the counties that we are providing services in at this time. Oftentimes our Serenity Home unit is completely full. When that happens, we recommend that they go to Hospice of the Rock River Valley. We know they have a very nice home there as well. So we've done a lot of referrals to their facility when we're unable to get a patient into our facility because we're full. Treating patients in this environment is difficult. We do treat patients who are positive with COVID. That's been a little scary for some of our nurses to go into a home when they know that there's a positive patient. We've also had situations where we've gone into a home where the patient's not positive, but after the patient dies, the family calls and said, well, we need to let you know that there were 4 family members that just tested positive. And we've had 8 clinicians in that particular home and 3 of them tested positive. So it's difficult, but we're doing all we can to provide care to those who need our services at this particular time. It can make it difficult, with shortages in staff when you've got staff out because they're positive or you've got staff out because they're quarantining, and just trying to keep everything going this year has been a tremendous challenge, but we have done it and we will continue to do so. We have not been able to have our fundraisers this year. Most of our fundraisers are large gatherings, and we just obviously can't and don't feel comfortable doing that. We did do a soft ask through a letter for our golf outing this year, and we did receive some donations to offset some of our expenses. So that was beneficial. We did get a grant from the Ogle County United Way. It was about 55% of what we have received in the past. There's just such a great need right now. And unfortunately, United Way is not seeing as many donations during this pandemic as they have in the past, so they don't have as much money to give out. So that's been challenging as well, but we're appreciative of all that we are able to receive. We also did get a PPP loan. We have been proud to say we've been able to keep all of our employees busy and employed. We have not had to lay anyone off. And I know that's the purpose of the PPP loan, and so that's been beneficial to us as well. I guess that's all I have to say, and I'll open it up for questions.
Any questions?
Just curiosity, what is your bed capacity there? Because you said sometimes you're full and you transfer to the other facility or recommend the other facility.
Our bed capacity is 8.
Thank you.
You're welcome.
Thank you, Lynn. Thank you.
Thank you.
All right, last I got is Village of Pawpaw. Kathy Groningen, have we called on her?
I think she's good.
Oh, who's with the Village of Pawpaw? I don't have that sheet in front of me.
Kathy's with Serena.
Who's it?
Kathy's with Serena. Kathy's with Serena. It would be.
He's not on here, but he's not on Zoom. Okay. All righty. Well, let's go ahead. Nobody from Pawpaw at all?
Last call for Pawpaw.
Just a comment to all of you that are here. Having sat on this committee for several years, the demand is definitely there. You all do a great job. We appreciate everything you do and as hard as you all work. And it's very, very difficult for us to sit here and decide how to split this up. So I assure you we'll do the best we can to help all of you.
We've got about, our levy's 100,000, same as was last year. And I guess we'll take a look at this. When I look at this on the first one, I don't see how you cut anybody with the year everybody's had. And we added the Dixon Public Library at 400, and maybe give Pawpaw 1,000, but I think you need to hold everybody where they're at.
We want to, usually these guys don't go home and we just talk about it.
Yeah.
Well, I mean, I don't know.
It's an open meeting, so I don't know.
Yeah.
The one issue that I have, and maybe if the library or Pawpaw's not here, we're a taxing body, the library is a taxing body. I'm not against the library, I'm not against, but when you have your own levy and your own resources, if you need more money, you need to make a case of that to your constituents. We didn't get to the library last year. They didn't ask us. So this is a totally, okay, because he mentioned that.
Well, in the past.
Guys, I've only been on for 2 years, so.
In the past, they've asked for money for this big brick books, and last year they said they didn't need it, they were in good shape for the year, and they wanted somebody else to have the money. Now they're back saying, hey, we need some assistance. So.
It's smart.
$100 is.
Yeah. I'd like to see it.
Well, it's just, I need to hear rationalization because everybody needs money.
Oh, yeah. If you give Pawpaw 1,000, the library 400, everybody else will the same. We're $101,400. We're a little over our levy, but we get some higher EADs, and it should be all right.
How you turn people down,
Yeah, we can't cut anybody out of here like this, so.
because they're not getting money from United Way.
Say that again, because I came up, I had kind of written down what I was thinking, and I came up with 103, so.
I got $69,500 for council on aging,
Oh, okay.
lifescapes, community care, 5,500, keep them all the same.
You're keeping everybody the same.
Yeah, and I added 400 for the library, and 1,000 for Papa. Papa works this.
Well, yeah, they're all doing good.
I just don't know what they're doing, whether they still do Meals on Wheels at that restaurant, or what did they?
I think that's what they've done in the past.
From the back of that bar. I went over there once to actually see what you did, and see.
I wouldn't mind going over there sometime.
Yeah, I don't know.
I do that.
And, then we cut them back, so.
Be able to do anything with local Meals on Wheels. And it's asking if there was any
Raise it what we did last year, then I feel bad, but everybody else, we're all the same boat.
Yeah.
I'll do what the committee wants to do, but.
I'm fine with your suggestion of, adding Papa and the library and keeping every, if we start choosing one over another, then we're saying we think you're more important, and they're all important.
Yeah, I can't do that in good faith and feel good about myself, but I get done, because they're all.
I'll make the motion.
The 101,
Keep everybody where we were last year, add 1,000 for Papa, the 400 for the public library, I think that puts us to 100
Yep. First and second, all those in favor, say aye.
Aye.
Motion carried. Thank you, everybody, for coming on Zoom tonight. It actually worked out good.
We wish we could give you more.
Thank you
Thank you for the support.
You bet.
Thank you.
Thank you.
Thank you so much.
Have a good night.
Good night.
So do we need to adjourn?
Good night.
So we'll need to adjourn from the hearing.
Yes, second.
Second from Lynn. All those in favor, say aye.
Aye.
That's a great.
Yeah, reconvene the previously held meeting.
Like that.